Welcome to The Cure. I'm your host, Errol Silverman, and we have a fantastic show for you today. We have Dr. James Gavin III with us. He is the past president of the American Diabetes Association, the past president of Morehouse School of Medicine, a well-known serial entrepreneur, philanthropist, and if I were to bring in all Dr. Gavin's medals and awards, it would fill up the entire studio. Without further ado, Dr. Gavin, thank you for joining us today.
Thank you very much, Errol. It's a pleasure to be here, and thank you so much for doing what you do to support our efforts.
I appreciate that. Thank you for your kind words. Now, can you share with us a little bit about your background and your backstory and what made you want to get into medicine?
Well, I go back to my early days in the segregated South. I was born and raised in Mobile, Alabama. Grew up in a segment of Mobile called Down the Bay. And as a matter of fact, there's an ongoing historical project in Mobile called the Down the Bay Project, because that entire segment of the city, which housed only African Americans, was completely eliminated with urban renewal, the interstate highway that came through. Right. But it really was the source of a lot of history. It's where I grew up, went to all segregated schools, because in the time that I grew up, that was what was happening. And when I left high school to go to college, my intent was to become a Methodist minister. I had no intention.
You got a great voice for that.
Well, thank you for that. But I had no intention of going into science. But when I got to college, it turns out that for a number of reasons, I became more interested in science, and I ended up majoring in chemistry and pursuing a degree in biochemistry as a graduate student. So I actually started out because I wanted to be a researcher. Did my PhD, I went to graduate school to get the doctorate because I wanted to be a bench scientist to do academic research, and that's what I did. Medicine was a very different issue because what drove me into medicine were two things. One was I discovered when I was working on the hormones that I started out with, which were gonadotrophin hormones, the sex hormones made by the pituitary gland, I was tired of making them because I had to go into cold rooms for 6 hours, start with pituitary glands, and I wanted to do something different than that. My mentor at the time, I was a fellow, he said, why don't you work on a hormone that's already been purified and you can buy commercially? And I said, I'd love that. He said, it's stable at room temperature. I said, enough already. What is it? He said, it's insulin. Well, I'd never worked with insulin, didn't know really what insulin was. I was a reproductive biologist. That's when I learned about diabetes. At that time, it was only then that I realized that that's what killed my great-grandmother. Diabetes. Sorry. And the more I learned about diabetes, the more I realized that it was a disease that ravaged my family. And I decided, you know, if I'm going to spend my life as a researcher in a laboratory, I may as well do research on something that's more relevant to my family and people that I know and love. But I had the wrong tools. I needed to go back to medical school, and that's what sent me back to medical school.
I'm sure your great-grandmother's looking down and is very proud of what you became. Actually, my A1C, I've always been this muscular. When I was heavier, my A1C levels were a bit elevated, and but I got them to be lowered. I think I might have just committed a HIPAA violation on myself, telling the masses that I had an elevated A1C.
As long as it's you and not me.
Right. I won't get arrested. So what do you consider some of your most meaningful accomplishments, especially in the field of medicine?
Well, in the field of medicine, Errol, I started out, as I mentioned, I was a bench scientist. So when I started working on insulin, I was working on insulin as a PhD scientist. And I was interested in finding out what is it that allows insulin to work in people. And at that time, the mechanism by which insulin causes glucose to be taken up into cells was poorly defined. My work actually was to identify the insulin receptor. This is the actual protein on the surface of cells that respond to insulin. That's where insulin binds, and it causes chemical changes in those cells that allow glucose to be taken up, used as fuel to supply energy and so forth. And so my early work involved a description of and discovery of insulin receptors in human tissues. And not only that, but my early work actually showed that those receptors actually were under the regulation of insulin. The higher the insulin level in the blood, the more those receptors decreased in their numbers to probably sort of protect you from overreaction of insulin. And so that was some of my early work. And then when I went back to medical school and became a physician scientist, I actually did clinical work. I actually did work on obesity. And one of the things that we did and that I'm quite proud of was the fact that we determined that when a person becomes obese, their body resets. Your body actually works to keep you at that weight. And so when you've reset, your body works to stay obese.
Oh,
and
wow.
So that really opened up
That's
a lot
wild.
of findings that helped us understand obesity better and how to do things that would change the dynamics of weight gain and weight loss.
That's a cool gold nugget that I'm going to share at parties. If you become obese, your body actually, because I would, it's almost counterintuitive because one would think your body wants to be at kind of baseline. But what you're saying is very interesting. The human body, I mean, you know better than I.
Yeah, your baseline resets. And the body says, well, this is my new baseline, so I'm going to fight to keep that.
That's wild. Now, if you could identify one driving force that really propelled your success in your career, what would it be?
I'd have to describe two events because one, what pushed me into academic medicine as a career was an event that happened when I was in graduate school. I was the first African-American student in my graduate school.
Oh, wow.
For a terminal degree program. And this was 1968. I had a paper to turn in for a seminar course that I was taking, and the professor actually invited me to a meeting after hours in his lab on a Friday afternoon, about a week after I turned in that paper. And his question to me when I went to that meeting was, who wrote this paper? And it was a shocking question because
oh my gosh.
I had worked as hard as I ever worked on anything on that paper. And at that time, I was a young man. This is 1968. I wore dashikis. I had an afro. You wouldn't believe it looking at me now, but I had an afro that was out to here. I founded the Black Student Alliance at the institution where I was in graduate school. And so it became contentious, let's say that. And it was clear that he didn't think that I was capable of writing what he called a high-quality paper. And I realized at that point in time that there was nobody that I could turn to. There was no faculty member, there was not an administrator, there was nobody that I could go to and say, you know what, I've just suffered a terrible grievance here. And I said to myself that I'm going to stay in academic medicine and be a person that students like me could turn to for moments just like this. And that's when I made my commitment to staying in academic medicine. And then when I went into medicine, of course, I went on to become a professor and a division chief and eventually a senior administrator in several high-powered research organizations. So that was a very important dynamic in my career. And the second thing that was a propellant, if you will, for my academic career was mentorship. You know, you just cannot overstate the importance of having people who believe in you, because remember, that guy was asking me, who wrote this paper? You know, I was fortunate enough to have people who were at the same time giving me encouragement and telling me that, you know what, you have what it takes. And in fact, it was the strength of that mentorship that really helped me decide not only to stay in academic medicine, but it taught me how to be a mentor. And that's basically the story of why I've done all of the things that I've done.
That's an amazing story, and I'm sorry you had to go through that situation. I wish that professor could see you now, past president of American Diabetes Association, president of Morehouse Medical School, and degrees that you can't, I couldn't even rattle off in a half hour.
Well, let me give you a quick appendix, because that was in 1968. I didn't finish my degree until 1970. But between the time I finished his seminar course and the time I graduated from that program, I was elected to the Graduate Student Council. I was elected to an organization called Omicron Delta Kappa in the graduate school. I was a student representative to the Board of Trustees. In other words, my star exploded. And when I defended my thesis, he said to the glassware washer in my laboratory, I wish we had 10 of him. He didn't say it to me, but he said it. She was the only other black person in the department, but he said it to her, and of course, she told me.
I wish we could clone you, because all the amazing things you've done for society, the world would be a better place. But that's, yeah, you showed them, hey, you used it as inspiration, and I can't believe that you went through that. I can't even fathom going through that. Now, you talk about mentorship, and I know you're very involved. In fact, you had run the Harold Amos Medical Faculty Development Program. Tell us a little bit about the background and the history of that program.
Well, I go back to the beginning of this program, because this program actually had its origins at the Robert Wood Johnson Foundation in another program called the Minority Medical Education Program. It was a program that was helping to get underrepresented students into medical schools. We developed that program, found out what are the qualities that people needed to have to really up their chances of getting into medical school, gave them experiences that would help them. But then after a few years, we found out that the numbers that we expected to see as a result of having this large, very robust program in place, the numbers weren't reflecting that. So we had some research done by the Educational Testing Service, and they said, the reason why we aren't seeing an increase in the numbers is because the people who are the gatekeepers to medical schools are faculty. And they're the ones who are on these medical school admissions committees, and quite frankly, they have determined that they're just not going to allow more than a certain number. And so we took that result back to the foundation, thinking that they would be disappointed and they wanted to get out of the business. They had a different reaction. They said, well, maybe what we need to do is to do a program that helps to fix the real problem. And that's what led to the development of at that time, the Minority Medical Education Faculty Development Program. So it grew out of an earlier program. And so I was there as one of the original advisors for the establishment of what is now the Amos Faculty Development Program, when it was known by another name. And it was designed to do many of the things that we've been highly successful in doing, identifying talented people, giving them a mentored training experience so that they could become leaders and role models who could actually not only do excellent science, but could actually foster the development of the next generation.
Now, who is Harold Amos? I mean, I can ask Alexa when I get home. She probably knows. And why is his legacy so important for the work you're doing?
If you looked up Harold Amos, Harold Amos was first one of the original members of the advisory committee. So Harold and I were on the advisory committee of the original program. And Harold was a guy who was the first African-American PhD to finish in microbiology and genetics at Harvard. And he became the first department chair at Harvard. He was the department chair of microbiology and genetics. He became the Maud and Laura Presley Professor of microbiology and genetics at Harvard. And he was a gentleman, an extraordinary man. He did his fellowship at the Pasteur Institute, became an avid Francophile. He didn't fly, so he took...
You speak French.
Je parle français, oui. He took trains and boats rather than airplanes. Harold was a generous, giving spirit and was a mentor extraordinaire. And in our program, when Harold passed away, he became when he became director of our program, Harold established a high bar for mentorship. He not only mentored those people that we recruited, but people that didn't get our funding. Harold made himself available to them.
Oh, wow.
And mentored many of them and made it clear that he was accessible to helping them. And many of them went on to do extraordinary things, although they never did receive our funding. And so, because of that kind of model that he set, we named the program after Harold when he stepped down in 2003, which was the 20th anniversary of our program. When he stepped down, some years later, the program was renamed after him. And so we try to live up to the standards that Harold set, not only as a person who pursued and was insistent on excellence, but a mentor extraordinaire. And that's why we are so proud to have that name in his legacy.
I love that, mentor extraordinaire. He really, truly was. And just setting up a program, mentoring people is good enough as it is, but to actually mentor people that didn't get in the program is surreal.
Yeah.
So now, in a perfect world, Dr. Gavin, where would you love to see the Harold Amos Medical Faculty Development Program? It's a bit of a tongue twister. Where would you like to see that in, let's say, the next 10 years or so?
Well, what we've done, Errol, as you know, is that the Robert Wood Johnson Foundation, which doesn't fund anything in perpetuity, will no longer fund the Amos Faculty Development Program after 2028, when the last cohort is finished. But we have set up the Amos Institute for Medical Faculty Development, so that now we are an independent organization committed to the same mission, that is, of identifying high-performing scholars in multiple disciplines, okay? And one of the things that we will do that builds on what we've done is that we will no longer simply limit ourselves to physicians, physician scientists, dentists, nurses, but we will extend our umbrella to other members who are important, other researchers and other scholars who are important in improving healthcare and the quality of medical knowledge, which includes PhDs, for example, public health scholars. So we're going to expand the umbrella of people that we are looking for and make sure that problems that have been understudied, populations that have been underserved will get the quality and the new insights the quality of care and the new insights that we need in order to do a better job in some of these chronic problems that our communities face. One of the things that I have to emphasize here is this. The data showed a long time ago that you were more likely to get better health and medical outcomes if there was some concordance between the patient who had a condition and the provider who was helping that patient. That there was more likely to be research done by somebody if they were working on a problem that disproportionately affected people that they cared about. In my case, it was diabetes. That's why I ended up doing diabetes. So it turns out that we really want to expand the reach of the people that we recruit and train so that we would have more people studying problems that disproportionately affected populations. We have more people interested in studying problems that affect rural populations. So that's why our umbrella has to be bigger, our tent has to be bigger, and why we will be looking to recruit a broader population of people to solve some of those problems that need the attention of people who have more, if you will, of a vested interest, if you will, in making sure that we push the envelope and find solutions, solve the problems that are affecting broad communities in our population.
I know there's been studies done that show that patients and doctors that look like each other oftentimes get better medical care. And a lot of it, I'm assuming, is subconscious, but that's just the reality of it. So what you're doing is kind of breaking that barrier. And I know, in today's day and age, a lot of money's been bleeding out of health studies, medical studies. How is your organization going to change the trajectory of what's going on right now in the United States?
Well, I think one of the most important things that we will be doing is, one, making sure that in these chaotic times when people are actually being discouraged by what they see, we want to make sure we keep hope alive. And that's not just a trite phrase. We want to make sure that these talented young people from these different backgrounds know that there is a future in research, that there is a future in healthcare, there's a future in all of the different disciplines that we have been working on and the problems that we've been trying to find. So keeping that hope alive and making sure that people don't start looking elsewhere for viable career options, that's a very important thing. And then providing those opportunities, providing pathways whereby they can get that training and get the mentorship that they need to become the leaders that we know that they can become. So we need to be a positive, viable example of what is possible. And when people know that they have this kind of program and these kinds of people, you know, our supporters and our National Advisory Committee and the people that we have produced as a result of this program for the last 42, 43 years, those are very strong statements to people who are looking to find out whether this is a viable way to go for the development of my career. And so this is why we want to make sure that we continue to do this work, that we do it in a highly visible way, do it in a way that really attracts these very talented and strong people who will become leaders in themselves, because now they will then become magnets for the kind of support and for the kinds of recruitment that we need to keep going forward into the future.
So not only is your organization built with a bunch of mentors within it, but the organization is one giant mentor, getting people to join the medical community where they think, okay, now this is a viable solution, a viable occupation, because there is hope. Well, Dr. Gavin, thank you so much for coming in today. I want to thank you for what you've done for society, for humanity, the thousands of lives you've touched and saved. And I want to present this key here to you to thank you for everything you do and continue to do.
Well, thank you very much, Errol. I appreciate this. This looks like a key that can open up a lot of doors.
A lot of doors.
Thank you for the help that you provide to us.
You're very, very welcome. And thank you for watching our TV and streaming show and listening to our radio show and podcast. And we'll see you next time.